all this for someone who has cancer or someone recovering can be a very traumatic event for them. Just going from the diagnosis through the treatment and, even the recovery, like once the cancer is gone, a lot of times people's bodies are just so, exhausted from everything that they still have a good year to like physically rehabilitate themselves. And a lot of that can be very, very stressful. So what do you see in your practice as far as just kind of the mental kind of post-traumatic stress syndrome that cancer patients experience?
Well, you've said something very wise, and that is many cancer patients are thought of as if they have post-traumatic stress syndrome, and that means that you're suffering from prior events that were stressful to you. And if you think about the cancer experience, the moment you hear the diagnosis, that's the big first stress, right? Then you get invasive diagnostic tests. Then maybe you get surgery. Maybe you get chemo. Maybe you have to be on a toxic drug for a long time. Maybe you lost a body part. Maybe you lost relationships or your ability to work. A lot of traumatic events happen in the cancer journey. So it's very important, I think, to be kind and compassionate towards oneself and also for the loved ones around to understand the multiple insults that happen during the cancer journey. And I have a patient right now who's been through a year of aggressive treatments and surgeries from a very advanced cancer. And she's very depressed right now because she thought, oh, it's over. I should feel better. But it's going to take her about a year. She's having some physical pain because she had multiple surgeries. She's exhausted because she's been through quite a lot. So she doesn't really have a sense of well-being. So when you're getting back to life, then a good question to ask is, what causes me to thrive? And then you want to put those things in that you know are the foundation of doing well. So having a really nutrient-dense diet, especially making sure you get enough protein, at least 60 grams of protein. That would be 3 4-ounce servings. That you're well hydrated, you drink plenty of fluids, at least 2 quarts a day, that you get enough sleep. I mean, this might seem very basic, but it has a very transformative effect on the body's ability to recover and repair and bounce back. And so if those basics are not in place, then you're going to have a longer recovery. And then I like to use adaptogenic herbs. And what that means, these are herbs that are useful to help us cope with stress. And so one of the most wonderful herbs for cancer patients is ashwagandha. It's an herb from India, and it helps you to relax when you're feeling stressed, but it also nourishes you so that you aren't so depleted. There's another herb called rhodiola, rhodiola, and this is an herb that really bolsters you when you're under great duress. It actually is used by Olympic athletes who also are under physical stress to produce stamina and endurance. And so it really helps us to cope with stress, but it also lowers stress hormone, cortisol, in the brain. So it allows you to sleep normally and also to think straight and be able to be clear and make good decisions. So there's a lot one can do to support oneself.
That's great. And I love the part about the protein in the beginning because often I have patients who are in physical therapy and they're trying to recover physically, and they don't understand that you actually need more protein when you're recovering because you're trying to rebuild tissue. So any tissue in your body that's rebuilding, when you're recovering from cancer, when you're recovering from any kind of surgery, you need more protein than you would normally eat within your diet. And I always tell people, try to go for organic protein because the amino acid profile is better, as well as the fatty acids, the omega-3s.
Well, let's say something about omega-3s because there is a physiology in advanced cancers. It's called cachexia. And in advanced cancers, the body will start to digest its own muscle mass. And so you can really feel weak from that. And so by increasing your protein and by increasing your omega-3 fatty acids, you can arrest that process. And so not only are omega-3 fatty acids anti-inflammatory, but they also have some anti-tumor signaling. So they actually stop some of the growth of tumor cells. So they're very, very important.
Excellent. And do you, supplement-wise, as far as protein, have you used, a wide spectrum amino acids or a protein shake or?
Well, I try to get the person to do what they'll tell me they'll do. Try to be practical, but almost all my treatment plans have a shake included, because quite often when you're sick, you don't really feel like eating. Mm-hmm. And also if you're not being very active because you're tired or in pain, then you don't feel very hungry. So I have a shake recipe that has 40 grams of protein in it. So if our minimum is 60 grams a day, but really you need 80 if you're under treatment or recovering from surgery or injury, then if you make a shake that has 40 grams of protein every single day, and then we can put some of the herbs in there too, so you don't have to swallow so many pills. We can put the fatty acids in there. We can put vegetables and fruits in there. So it could be a meal substitute as well as a therapeutic drink, right? Mm. So almost all treatment plans have a shake in them. And so I think that's a good strategy.
I like the idea of opening the capsules and putting them in, because as you said, therapeutically, you can take somewhere between 4 and 6 capsules, sometimes twice a day, which people, they kind of get pill fatigue. So open them up, put them in the shake, and that's a nice way to take it.
Yeah, so it's a good strategy, and you don't even have to drink the shake all at once, right? You can drink half of it, get your 20 grams, drink another half. And I also, when giving a liquid protein drink that is very concentrated, I also give a digestive enzyme with it that has a high amount of protein digestive enzymes in it. So you absolutely get the most absorption out of that liquid drink that's going through your digestive tract more quickly than food would.
Excellent, excellent. So this has been Dr. Nalini Chilkov. It's been an excellent interview. Tons of great strategies here for people. Tell us where they can find out more information about you. Obviously, your practice is in Santa Monica, California, but you also have a couple of websites to let us know about.
Well, the main website where there's a lot of free information for people is integrativecanceranswers.com. And we actually have a page on the site that's integrativecanceranswers.com/gifts for all of your community. They can download 7 free reports with lots of this information for free for them. So they can go there, and there are a lot of free resources on that site. And there's actually a blog post called A Better Breakfast on the site that has my shake recipe on it.
So cool. We'll check that out.
Yeah.
Excellent. Yeah. Anything you'd like to leave our viewers with today regarding cancer and your approach and where we're heading in the future?
Well, I think the most important thing to know is that it's very important, if you or a family member has cancer or cancer risk, to take control of that and look for the tools that create a body where cancer cannot thrive, and build that body and get that information and learn that, because then you feel not at the effect of it so much. And if you are under care of a physician, then you build a team where you have the best cancer docs, but you also have the best health experts on your team, so that when your disease expert doc is done with you, you still have a plan for your health in place that's going to last you for a long time.
Excellent. Excellent. I love it. So I encourage everyone to follow Dr. Nalini Chilkov on www.integrativekanceranswers.com. She's got tons of great information for you there to help you prevent cancer, which is the most important thing. And it's been a great interview. Thank you so much. And this is Dr. Joe Tata signing off for today's Healing Pain Summit, and we'll see you in the next interview.
Join me for my comprehensive Foundations of Integrative Oncology course, which includes monthly live grand round calls with me where you can ask your questions. You can start transforming your practice today so that you can become the go-to expert who is truly prepared for the rising tide of cancer patients and survivors who are looking for a skilled and knowledgeable clinician who can provide them with the health side of the cancer equation and help them take control of their health and support them through all phases of the cancer journey and beyond. Click on the link below now to get immediate access to all of the modules, print-on-demand patient support documents, and quick reference clinician guides, as well as learn how this course has transformed the way other clinicians like you practice.